Good afternoon, everyone. We will get started in about 1 minute. So Maine public, we are 1 minute out.
May I record?
Sure. Good afternoon, everyone. I'm Nirav Shah, Director of the Maine CDC. I'm delighted to be joined this afternoon by Commissioner Jean Lambrou from Maine's Department of Health and Human Services. Commissioner Lambrou and I are pleased to be with you this afternoon to provide you an update on where we stand with respect to COVID-19 for today, Thursday, September 2nd, 2021. I'll begin by providing a sense of where we are from a public health and epidemiology perspective, and then turn things over to Commissioner Lambrou. And I begin my update today on a sad note. The Maine CDC is reporting the deaths of 3 additional individuals with COVID-19. One was a resident of Cumberland County, another a resident of Penobscot County, and a third a resident of Somerset County. 2 were women and 1 was a man. 1 was in their 50s, another in their 70s, and another in their 80s. These 3 deaths bring our total number of deaths in Maine associated with COVID-19 to now 937. Commissioner Lambrou and I would like to take a moment to offer our deepest condolences to the friends, family members, and communities of all of those who have died with COVID-19. Statewide, there are a total of 76,913 cases, an increase of 624 cases since yesterday. Cumulatively, across the state, 2,315 people have been hospitalized. And right now in Maine, 160 people are in the hospital, an increase of 10 people in the hospital with COVID-19 since just yesterday. Of those 160, 67 are in a critical care unit bed, and 26 are on a ventilator. That's an increase of 1 person in the ICU and an equal number of people on a ventilator since yesterday. But compared to 2 weeks ago, we've seen an increase, significant increase, in the number of people hospitalized with COVID-19. 2 weeks ago, 1 incubation period ago, there were 93 people who were hospitalized, 67 fewer than today. 2 weeks ago, there were 44 people who were in an intensive care unit bed, 23 fewer than today. And there were 19 people on a ventilator, 7 fewer than today. Among all of our cases, 5,614 have been among healthcare workers, an increase of 29 healthcare workers since just yesterday alone, underscoring yet again our focus on vaccinating healthcare workers across the state. And statewide, in terms of capacity, there are a total of 328 ICU beds, 45 of which are available as of this morning. In terms of outbreaks, there are a total of 33 COVID-19 outbreak investigations that are open right now, 19 of which, more than half of which, involve healthcare facilities or group homes across the state. Once again, underscoring our focus on making sure that healthcare workers are vaccinated. Speaking of vaccinations, we've seen a 31% increase in the number of doses administered per day across the state of Maine just in the past 2 weeks, a 31% increase in vaccination rates over one incubation period. In terms of where we stand overall, 81.3% of the eligible population across Maine has received one dose of COVID-19 vaccine. That's those 12 and over. And in terms of who's fully vaccinated, 3 out of every 4 eligible people in Maine are now fully vaccinated. 3 of every 4 people you meet on the street right now, if they're 12 and over, have been fully vaccinated. And 2 final notes before I turn things over to Commissioner Lambert. The first is with respect to our ongoing review of positive COVID-19 cases. At this time, we have 1,800 lab results, positive lab results, that are awaiting our review. Now, I want to be clear, this is not the same 1,700 that I reported on last week. It's a different set of lab results that we are now waiting review on. I want to assure everyone that we are moving more and more people to our epidemiology team to plow through these positive results as quickly as possible. But what that means for you is that the number of cases that we are reporting right now is certain to go up in the coming days as we plow through these 1,800 cases. As we move our way through them, we will likely continue to see the sustained high number of cases that we've seen over the last few days as we move through those cases. And finally, speaking of testing and lab results, we acknowledge and recognize that there is a challenge statewide, nationwide, with respect to accessing testing. We've heard that from you. We've seen it in our own numbers, and Commissioner Lambert and I are taking steps to address it. For example, we're working with the manufacturers of rapid tests to acquire as many of those tests as possible for the state of Maine. We're also working with pharmacies across the state to see how and where they can expand the number of locations that are offering testing, as well as the number of hours per day that each location can offer testing. We're also making more COVID testing available in high traffic areas, like at the Portland Jetport. This strain on testing availability is being driven by 2 things: supply and demand. On the supply side, the companies that make the tests that we use are ramping up their production to churn out as many tests as possible. But right now, supply remains a concern. On the demand side, things like healthcare facility outbreaks, which, as I mentioned, are 19 of our 33 outbreaks. Healthcare facility outbreaks mean and require frequent, repeated, large-scale universal testing of staff and residents. That frequent, repeated, large-scale universal testing means that many of the laboratories in the state right now are focused on responding to outbreak testing. We absolutely hear you and understand that we need more testing in the state. We are working and committed to making that happen by undertaking the steps that I outlined. As we make progress there, I will continue to provide updates. With that, I'd like to turn things over to Commissioner Lambert.
Thank you, Director Shaw. I'd like to announce that the Maine Department of Health and Human Services will begin its enforcement of its COVID-19 vaccination requirement for healthcare workers on October 29th, 2021. This provides additional time after the October 1 deadline for healthcare workers to complete their vaccination protocol. With the full authorization of the Pfizer vaccine last week, it allows workers who prefer that vaccine to get it. And it also allows for healthcare organizations to use the $146 million in forthcoming funds to address workforce needs. The Mills administration announced yesterday that it is distributing $146 million in state and federal funding to Maine nursing facilities, certain residential care facilities, adult family care homes, and hospitals to support workforce recruitment and retention efforts, among other COVID-related activity. The Maine Department of Health and Human Services will begin issuing these payments this month to support these facilities prior to the administration's beginning of the enforcement of this rule. As the governor has said, the goal is that every healthcare worker in Maine is vaccinated. Anyone who is placed in the care of a healthcare worker has the right to expect as do their families, that they will receive high quality and safe care from fully vaccinated staff. Our policy, along with this new funding, will help protect the lives of medical staff and patients, protect our healthcare capacity, and reduce the spread of the virus. And with that, I'll turn it back over to Director Shaw for questions.
Great. Thank you very much, Commissioner. Let's turn to some questions from our colleagues in the media. And the first question for the afternoon goes to Pat Callahan from News Center.
Good afternoon, Dr. Shaw. What do you think explains the vaccine reluctance among so many healthcare workers who we've seen protesting in recent weeks? I mean, they certainly have medical knowledge to draw on. So what is it that you think is keeping them from getting vaccinated?
You know, Pat, I can't speculate as to what different motives that folks may have are. And I say that recognizing that different healthcare workers who have not yet been vaccinated may within themselves have different concerns. But what we've heard is, I think, two general categories. Some folks who still remain or still have open scientific questions, many of which I believe have been answered. For example, the FDA's recent review and approval of the Pfizer vaccine literally gives the stamp of approval for that vaccine. That's not to suggest the other two vaccines are any less safe or any less effective, but we've heard from a lot of folks, healthcare workers in particular, who have said that they wanted to wait for that seal of approval. Now they've got it. Similarly, we've had other healthcare workers who have said that the vaccines were rushed or that there may be long-term side effects. Now, in terms of the vaccines being rushed, what I think is important for everyone to know is that it's true that the vaccines were made very quickly. And that's because given the importance of the pandemic worldwide, all of the regulatory red lights were turned to green. So the vaccine could be moved along with top priority. In terms of long-term side effects, Pat, I hear that concern. I understand where it comes from. But the fundamental question on the table today, on a day where just compared to yesterday, 29 more healthcare workers have been diagnosed with COVID. More than half of the outbreaks in the state involve healthcare facilities. The question on the table today is, what's the bigger risk, COVID-19 or the vaccine? And for me, based on every piece of data that I've seen, there is no doubt the answer to that question. The biggest risk out there right now for healthcare workers and non-healthcare workers alike is COVID-19.
And finally, what are your thoughts on what the
Hold on,
FDA?
Pat. Sorry, Pat, I want to make sure Commissioner Lambrew can weigh in.
Yes, I'm sorry, Commissioner.
No problem. I was just going to say quickly that it is notable, though, that since we did put out this rule, we have seen an increase in vaccination. Maine Health and Northern Light both report that they have seen significant increases in their staff who've gotten vaccinated. Overall, those systems are close to 90% of their staff who are vaccinated. We're confident that as we go through the next weeks, we will get even more of these employees who are vaccinated with education, with new information, as well as with this requirement. So we feel confident that we will get to that goal the same way we've done for years with the flu vaccine and other required vaccinations for healthcare workers.
Thank you. Dr. Shaw, what's your sense of where we are on the FDA approving booster shots for those who aren't already eligible, being immune compromised or such?
Well, Pat, there are two steps there for federal health authorities and their advisory committees. One is the FDA, and then the other is an advisory committee to the US CDC. Those committees and those boards are setting up their meetings for the next couple of weeks where they will take a look at the data around boosters. I can't speculate and certainly don't want to get ahead of any decisions, analysis, and debate they may have. So I'm eager to participate, at least in the discussions with the US CDC's advisory committee. Similarly, eager to keep tabs and learn from the FDA's committee. But in terms of what they may decide and what the final parameters may be, we're all looking forward to hearing that analysis.
Thank you.
Thanks, Pat. Let me go to Caitlin Andrews next.
Oh, it was much earlier. Good afternoon. Thank you so much, Dr. Shaw and Commissioner Lambrew. These questions, I guess, could probably be to the both of you. I was wondering if you could explain the timing difference that we're seeing around this testing change. How is this enforcement of October 29th versus October 1st going to help employers? Like, what is like the practical change that we're seeing here?
Sure. Maybe I'll begin and to clarify, we are talking about a vaccination requirement, not a testing requirement. And I think what
Apologies.
yep. So, there's been a few things, as Director Shaw said, that have happened since we made the announcement a couple of weeks ago. Number one is the full authorization for the Pfizer vaccine, which means some of those healthcare workers who prefer that vaccine can get it. Number two is that we are moving out on this funding support. We do recognize that there are concerns about the healthcare workforce in the state of Maine. Those concerns predate the pandemic. We've been working on improving and expanding the healthcare workforce in Maine since the Mills administration arrived 2.5 years ago. We last year during the pandemic provided $30 million for hospitals and nursing homes to support them. The end of last year, we provided funding through coronavirus relief funds for nursing facilities. Just last week, we provided another $25 million for those facilities to shore up some of their COVID-related funds. And these new supplemental payments that are going out will give them the resources with which they can help try to make sure that they provided the right type of incentives for this vaccination effort.
Caitlin, I just wanted to chime in, Commissioner, correct or weigh in if you see this differently. But Caitlin, the deadline remains October 1st. That is the deadline by which healthcare workers that are covered under this rule should get vaccinated. So if you're a healthcare worker, you're watching right now and you haven't been vaccinated, this is not a situation where you've got 28 more days. The deadline remains October 1st. What we've moved is the date on which we will begin enforcement of that. But the deadline remains, and if you're a healthcare worker, haven't yet been vaccinated, this is your weekend. But Commissioner, is that a fair summation?
It is. We just are trying to cut a little slack for people who may be a little late or for organizations that might need that extra time to come to compliance.
Okay, then can you, I guess, explain to me a little bit more of what the enforcement element of this will look like? Like, how is that going to play out on this October 29th?
Sure. So this immunization rule is a longstanding rule that's been in Maine regulation and law for about 2 decades. And what it means is that we do use reports from facilities to Maine CDC that are taken into account in our licensing and certification decisions. So it's no different of our enforcement system than we've used for years.
Okay, and thank you. My last question, I guess, would be that, it seems certainly like healthcare workers or employers are struggling with this vaccine requirement in terms of, employees still being hesitant. Is there any wiggle room around the idea of offering a testing alternative rather than straight up requiring vaccination?
So I'll begin and let Dr. Shaw jump on in to say that, there are some other states that have offered that as an alternative. I think we believe that the number one best way to protect against COVID-19 is the vaccine. We have in the state of Maine had longstanding policy about the battery of vaccines and immunizations that help keep workers safe. So we maintain that our approach here in Maine is the more effective approach from a public health perspective.
Completely concurred. And Caitlin, I just wanted to chime in, not to quibble, but Commissioner Lambrou noted, and we've heard from hospitals, healthcare systems, designated healthcare facilities, that the rule is working. Their staff are increasingly getting vaccinated, and many facilities across Maine have seen significant percentage point increases with respect to the numbers of their staff that have been vaccinated since Governor Mills unveiled the rule. So we think it's working. As with any enterprise or endeavor, the last mile, the last quarter mile, the last yards, those are going to be the most challenging. And that's why we're focusing on a ground game to help those healthcare workers and make sure they've got what they need. We know that's going to be the case in any human enterprise, but we think it's working and we definitely think it's the right thing to do.
Thank you.
Thanks, Caitlin. Let me go to Allegra from WABI.
Hi, Dr. Shaw. My question is related to the third dose or the booster shots, and how is the state going to think about tracking those, or if you already have started tracking those for those who are immunocompromised, what is that looking like for the public's knowledge?
Sure. So on the dashboard that I encourage everyone to take a look at, we post all of the numbers with respect to how many doses have been administered, how many of those right now are first and second. In the near future, we'll be adding a new category for third doses. This will be how we monitor and track and report out to the public what the uptake rate for boosters and additional doses have been. I just want to make one point there, Allegra, which is I know that there's been a lot of questions and as well as focus around boosters and third doses. But the thing is, our focus simultaneously remains on first doses. You can't get a third dose until you've gotten your first dose. And so we're really focused on getting folks those primary vaccines because that's where a lot of the protection starts.
And then with that, not to go back to the third dose of those boosters, but once that does become available for everyone hitting that September 20th mark, right now, is it more just once you hit that 8-month mark, you're good to go? Or will there be a more strict rollout with how the public can go about that?
A lot of that will depend on the recommendations that are made at the federal level for how states should implement and effectuate this rollout. We're waiting to hear with finality what those decisions are based on what we've been briefed on thus far, and that might change. There's an 8-month window effectively after the date you got your second dose, and that will govern how folks move through their boosters. But there are still questions that are out there around the precise implementation. And so once we hear what the US CDC's decisions are there, that's how we'll structure our rollout.
Great, thank you.
Thanks, Allegra. Joe Lawler, over to you next.
Yes, hi. Thanks for taking our questions today. I guess my first question is just a simple clarification. So you're saying that the October 1st deadline remains intact. And I know you said enforcement wouldn't begin until 28 days later from the state standpoint. But I'm wondering if you're an employee and the deadline is still October 1st, I mean, depending upon your employer, you could be putting your job in jeopardy if you don't get your shots by October 1st. Is that a fair assessment?
So let me try answering, then Director Shaw jump on in. So employers can set their own deadlines, and we have seen them do so because early on, we had several of our hospitals, for example, and health systems set a deadline for their workers. They can accelerate this, and organizations outside of healthcare have also been setting vaccination requirements for their workers. So nothing about what we announced today changes. All that's changed today is when we go about the work of enforcing the immunization rules, we will look towards what the vaccination status of facilities are in November, not October 1, for those enforcement decisions. That's all that's changed. And I would note that, again, this is applying to the healthcare sector, not other sectors. There is support from the Maine Hospital Association, Maine Healthcare Association, a number of associations and physician groups as well. And, you know, I think one of the fundamentally different things about healthcare versus other sectors is that Hippocratic oath, do no harm. So we appreciate that we do, again, have to work out that last mile set of issues that Director Shaw mentioned, but we feel confident that this is going to make our hospitals, nursing home, and other healthcare facilities safer.
Okay, thanks for that. And then I guess I'm wondering also, since this has been, since you're saying this has so far been pretty successful, is there any discussion about additional vaccine mandates for other sectors?
I can get it, or
Oh, hello?
There
Go ahead, Joe. Sorry,
Okay.
Commissioner, please.
Yep,
okay, I'm Lindsay.
Sorry, everyone. If you're not Commissioner Wambrew or Joe Lawler, could you please mute your line? In fact, even if you are Joe Lawler, could you please mute your line?
No problem.
We are not considering other vaccination policy at this time.
Thank you, Joe. Let me go to Amy Brown next.
Thank you, Dr. Shaw and Commissioner Lambrou. Dr. Shaw, you've said that the AMA has reported that about 90%, I believe you said, of doctors have been vaccinated. So who are the healthcare workers who are still resistant? Is there any indication of a correlation between the level of medical training and vaccine acceptance beyond that AMA stat?
Amy, that's a good question. Let me just note that that AMA stat is now several weeks, if not maybe even months old. So I would be interested to see if the AMA has updated that. But to your specific question, Amy, I don't have any numbers of that sort that I could point to, either Maine specific or nationwide. And so it's an interesting inquiry, but I don't want to get over my skis and speculate. I'm not sure whether there is a correlation there, but it is something that perhaps other groups have looked into. But Amy, what I think is interesting is that although there is focus right now on what this might mean for the workforce, I do think it's really important for folks who are watching to appreciate that right now at baseline, even without the mandate or the requirement having reached its due date of October 1st and now enforced on the 29th, even without all of that stuff, we're already seeing workers who are having to be out because they need to be in quarantine or they need to be isolated because they've got COVID. As I've mentioned, we've had almost 30 new cases among healthcare workers just since yesterday. I don't know what fraction of those folks would have been covered by this, but it's fair to say a fair number. Similarly, more than half of the outbreaks that we're contending with are in healthcare facilities that would be covered. So we're seeing impacts of COVID right now driving a lot of the concerns that we have.
So are you saying those outbreaks, the 19 outbreaks in healthcare facilities, are related to unvaccinated workers?
Most of the time, in fact, well, yes, I don't, almost all of them, so far as we are aware. As you know, one of my rules is never, ever, ever speak definitively on anything, but almost all of them, if not all of them, are related to unvaccinated individuals.
Okay, and I have a couple of questions from listeners. One says that they thought they recently heard you say that vaccines present zero risk, but they've also heard you in the past talk about adverse events. So they would like an update on how many adverse events there have been, how bad they are, and who is most at risk.
Sure. There is no intervention in the history of medicine that has been zero risk. If I have ever said that vaccines are zero risk, I don't believe I have, but if I have said so, then that's not something I should have ever said, because in the history of medicine, nothing has ever been thought of as zero risk. Vaccines are exceedingly low risk. And indeed, Amy, about a week ago, I think you asked me how many people in Maine were hospitalized because of adverse events for the vaccines. And the answer to that question is zero. Right now, we've not seen significantly more adverse events from the vaccines than what we've seen in the first weeks after their rollout. That is to say, we haven't uncovered new categories of adverse events since early after their release. We were aware of, for example, joint injection site pain, maybe people feeling crummy a day or two after they got their shot, a small number of people with the mRNA vaccines, very small, having anaphylaxis, and then reports of things like myocarditis, et cetera. Those have not increased in number. They haven't increased in frequency other than the rates that we've seen thus far. Across the country and across the state, hospitals are filling up with people with COVID-19. You know what they're not filling up with? People with adverse reactions to the vaccines.
Okay, and another listener would like to know how risky it is for two fully vaccinated people who are both wearing masks to be in close proximity inside, such as getting their hair done or having a massage or something along those lines.
Amy, as you know, we're in this world where now there's no such thing as safe, unsafe, risky, not risky. It depends on whether those individuals have chronic medical conditions, whether they live with people who may be immune compromised, so on and so forth. But let me say this, the situation that you described on the spectrum of risky and safe is definitely on the safer side of the spectrum.
Okay, and just one final one. Another listener, I've been collecting these from listeners over the last couple of weeks, and a third listener asked about the status of the Novavax in the U.S.
Yep, that vaccine is working its way through its clinical trials and its submission and review process with the US FDA. I suspect that it will be many, many weeks, if not months, if an EUA is issued before that were to happen. It's a
Okay,
promising vaccine, but I think we're still a ways away there.
great. Thank you.
Thanks, Amy. Let me go to Mel Meyer next.
Thank you, Dr. Shaw. We talked to a residential care facility administrator that said it would not require staff to get vaccinated. What would you say to her and others that don't want to enforce a mandate?
So I'll begin by saying, that if that residential care facility is subject to this vaccination rule, it will be the same process that we expect that this facility has been following for flu shots and hepatitis B and other mandatory vaccines. We always try to work with facilities to see how we can help. Is there additional education that's needed, educational material? Do they need more vaccine supply? We're always willing to help work with facilities to come into compliance. But at the end of the day, this is about the health and safety of those staff and of the residents in those facilities. So we feel as though, and with the backing of some of our major associations nationwide, there are 60 organizations that represent health care providers who support this idea of mandatory COVID-19 vaccination. So we maintain our firm commitment to ensuring that these workers are vaccinated. And if that facility fails to follow the immunization rule, we'll follow the usual enforcement process that we do, which is it will potentially pose a risk to that facility's licensure.
And then I do have some additional questions. In talking to them, one of the reasons was that there just aren't enough staff out there. What difference will this funding that you just announced make if there just aren't workers out there and now many may be forced out or unhireable?
Sure. So as a reminder, we have ebbed and flowed in terms of our healthcare workforce here in the state of Maine, always a challenge, which is why Governor Mills included $20 million in Maine Jobs and Recovery Plan, for example, to expand our training programs, improve recruitment into those programs, as well as offer facilities different types of bonuses and retention efforts. And we'll continue to do that. We're going to continue to work on the financial supports for our healthcare facilities, including residential care facilities, to attract and keep workers. We believe that people want to go into healthcare because it is a area where you can help people, improve their lives, improve their functioning, live with the kind of opportunities that they are interested in pursuing. So we think it's a great career area. So we'll continue to work with all those facilities in the short and long run to make sure that they have the high quality healthcare workforce that our Maine residents deserve.
And then my final question is just really about this additional time. What difference will a month make if healthcare workers are firmly against getting the vaccine?
Again, I'm going to go back to our first principles here, which is we think the vast majority have and will continue, I think, to support the health and safety requirements in this rule. If a facility needs additional time to do that recruitment of additional staff who are fully vaccinated, who will be able to care for those patients or residents with the level of safety that I think the public expects, that could be an additional plus for them. They can take that extra time to secure that staff should they lose staff due to this policy.
Thank you.
Thanks, Mel. Over to Carol from Maine Public.
Hi, good afternoon. Thank you. My question is about the $146 million of funding. Is this newly allocated money or reallocated money? Where is it coming from?
Sure, I'll answer that. So Governor Mills in May introduced what we call the Part 2 budget as a means to complement the baseline budget that was passed back in March. We included in that budget a recommendation to do these one-time this fall supplemental payments to hospitals and certain long-term care facilities for reasons very similar to this. We knew that during the pandemic, as we just were talking about with outbreaks, these are the facilities on the front lines that have been hardest hit by the pandemic. We anticipated that we would need support, and the legislature passed on a bipartisan basis the general fund amounts that we're allocating now, or at least some of them, what we're doing is then getting federal Medicaid matching payments. So the amount that is in the budget will be then supplemented by federal Medicaid funding. And our goal is to begin the process of moving that funding out to these facilities this month.
Thank you. Are any expedited orders necessary by the governor to do this, or it's already in the pipeline moving forward?
It was passed by the legislature, signed into law by the governor, and we're now working on our approvals from the federal government to move this out as quickly as possible.
Thank you.
Thanks, Carol. Over to Corey from WAGM.
Thank you, Dr. Shaw and Commissioner Lambrou, for taking these questions. My first question is, have you considered maybe allowing some of the, or what is the reasoning for not allowing some of the unvaccinated workers to continue working in situations like telehealth, where they're not directly interacting with patients on a day-to-day basis?
So I will begin by saying we do have some FAQs that clarify some of those kind of circumstances about, how does this work? And we do say that if there are workers who are working remotely, they may not be subject to the same rule. And I'm looking for that precise FAQ as we speak.
And the focus there, Court. Oh, yeah, please, Commissioner, sorry.
Yeah, and again, it is just, again, we do allow when there is remote work at a healthcare facility, that worker, him or herself, is not subject to this rule.
And Corey, it's not occasional telework. It's not from time to time. It is entirely 100% non-patient facing, no patient interaction for obvious reasons. We don't want this to be an end run that could potentially end up infecting patients.
Absolutely. My next question is, are you worried about maybe some less qualified applicants, some applicants that healthcare workers or healthcare facilities maybe wouldn't have looked at within their first round of picks, getting hired simply due to the fact that they are vaccinated, whereas some of the veteran healthcare workers who really know what they're doing are getting let go?
Our healthcare facilities here in Maine maintain a reputation nationwide for being high quality. They have, over the years, generated a reputation that I think, again, is about providing patient safety and quality care. We expect that, as they are implementing this policy, as when they implement other policies, including the flu vaccine requirement and others, we'll maintain those standards of quality. So we appreciate the work that our healthcare facilities do to keep people who are in their care safe, and we expect that will continue.
Thanks, Corey. Let me go to Megan next.
Oh, okay. I'm unmuted. Thank you. You'd think I would get this by now. I appreciate you taking my question. Are either of you or both of you ever recommending that any other profession outside of healthcare implement a vaccine mandate? My thought is, you've got a bunch of kids under 12 in schools who are unable to be vaccinated. And it seems like the unvaccinated are those who make up the majority of the cases in the hospitals right now. So it would seem to me that, there could be a mandate for teachers. Is this anything that you're thinking about recommending?
We just launched yesterday a survey for all of our schools in Maine to find out exactly how many of the school staff are vaccinated. The deadline for schools to fill that out is September 10th, and we look forward to getting that baseline data. We hear different things. We hear some schools and school administrators who think that they are very close to having full vaccination among their staff. We look forward to getting that information that we will publicly post when we have it as a baseline to figure out what, if anything, we can be doing to promote vaccination among our school staff. So we continue to look at all of our options about how do we promote vaccination. We do have, again, different parts of the state where the vaccination rate is very high without requirements, and we have different sectors of our workforce where we also see high rates. So we continue to try to do our baseline assessment of risk, where are people vaccinated, what else can we be doing voluntarily, and what other policy changes we might implement should we need to.
So essentially it's on the table, right? I mean, I guess that's a fair, once you look at the data.
Yeah. I think it's safe to say that in a pandemic where we're still learning as we go, I mean, Delta variant is teaching all of us new lessons, oftentimes hard lessons about what COVID-19 means. Nothing is off the table until this pandemic is truly over. But at this time, we have no new vaccine requirements to announce.
Thank you.
I'm recommending that members of the Maine media get vaccinated. That's on the table. The final question for the afternoon goes to Dustin.
Thanks. First, are you concerned about Labor Day weekend visitors causing COVID-19 cases to rise further here in the state?
Well, yes and no, Dustin. Yes, in the sense that there's going to be more people in the state. No, in the sense that what we've seen now through pretty much 2 summers in Maine is that Maine has been able to do summer without necessarily causing corresponding or absolute increases in COVID cases. I know there's been an increase recently, but there's not data from our case investigations to suggest that tourists or tourism-related enterprise businesses were the reasons for that. A lot of what we see that's generating outbreaks are either facilities and workplaces, or when we ask people where they're getting COVID from, it's small gatherings, household gatherings. So yes, in the sense that anytime there's more people, it's a higher risk, but overall, not particularly, because generally speaking, tourists and tourism in Maine, often an outdoor venture. And secondly, we've now had, again, 2 seasons of summer activities that haven't directly or causatively been linked with increases in cases. That being said, you're coming to Maine this weekend, you're already in Maine, take precautions this weekend. If you haven't been vaccinated, be smart. Stay indoors, wear a mask, try to limit your exposure to others. Even if you have been vaccinated, I recommend that you wear a mask in any county in Maine where there is substantial or high transmission. You can find that list on the governor's COVID website, and you wear a mask even if you're vaccinated anytime you are in an indoor public setting. It's an easy thing to do. It protects you, protects your family, and it will protect those around you.
Now, if we have a surge in visitors as in years past and some of them need intensive care, could that be a big strain on Maine's healthcare system? And should those folks expect the same level of care as normal?
Well, it's a lot of ifs in those in that question, Dustin. So there's only so much I can speculate. What I can tell you is that right now here in the state, we've got 40 plus ICU beds that are available. And generally speaking, we haven't seen significant spikes in prior Labor Day weekends that would overwhelm that system. The possibility that someone could come to Maine, fall ill with COVID or something else, and potentially need a bed, it's not zero, but it's not something that necessarily would cause us to tip into an acute status. It's a risk. But your question also highlights another component of where we are, Dustin. Right now, when we talk about COVID, we often talk about the direct effects, people who are sick with COVID on a ventilator. But we're starting to see, because hospitals are packed, the indirect effect of people not being vaccinated is that they end up in the hospital, they end up in the ICU, and they end up on a ventilator. And what that means for non-COVID patients is now starting to come in sharp focus. If you've got cancer, if you've got heart disease, we are starting to hear about and see access challenges for those individuals, not because of their own disease, but because hospitals are facing challenges with COVID. And what I don't want to see is delays in others who don't have COVID, delays in them seeking care. Because in healthcare, care that is delayed is care that is denied.
And lastly, listening to Dr. Jarvis at Northern Light Health yesterday, it sounded like he was saying that various data shows that Maine's about 2 weeks behind the rest of the country in terms of patterns in the Delta variant surge. Is that something that you agree with? And does it tell you anything about where we're going in the pandemic or where we are now?
Yeah, I do agree with that. I may quibble. It may be 12 days, it may be 15 days, but I concur with Dr. Jarvis in that estimation. The way that the virus has been moving across the country, particularly Delta, starting in the southeast, made a pit stop in the Ozarks, and then, of course, spreading outward from there. What we have seen is 12 to 16 days or so trends that we're seeing in the southeast find their way here.
Got it. And does it say anything in particular about anything in terms of where we're going, or too early to?
Too early to speculate. There are some somewhat optimistic signs on the horizon, but it is way too early to take anything like that to the bank.
All right, thanks.
Thanks, Dustin. And thank you all, and to all my colleagues in the media. Commissioner, I'll turn things back over to you to round us out.
Great. Thank you so much. Just want to remind people that, we are talking today about this healthcare worker requirement to get vaccinated. We do recommend everybody get vaccinated. We have vaccines available across the state, in pharmacies, in different clinics. And if you're having trouble finding a vaccine, remember you can go to maine.gov/COVID-19 vaccines, or call the community vaccination line at 1-888-445-4111. Thank you very much.
Thanks, Commissioner, and thanks everyone for taking some time out of your afternoon for joining us. We very much appreciate it. We hope everyone does have a safe, relaxing, and restful Labor Day weekend. As always, please be kind and take care of one another. We will all talk again soon.